My name is Dr. Marla Shapiro. I was 48 when I had my routine mammogram and was diagnosed with invasive breast cancer. I went through 8 rounds of chemotherapy. Following the chemotherapy, I had bilateral mastectomies. Both my breasts were removed, and I started a process of reconstruction. In addition, I had a complete total hysterectomy and bilateral oophorectomy. Both my ovaries were taken out. It's almost as if any body part I could possibly get rid of, I said goodbye to, that I no longer needed or I no longer felt were my friends. Being a physician was probably the best thing and the worst thing simultaneously. People asked me if it was easier because I was a physician. The only thing that was easier is that I understood the technical language. That's what was easier. The worst part of it was that as a physician I could only think of the worst case scenarios. I could only think of the exceptions to the rules. I could only see the dark side. Not because I'm a dark person, but because I've just walked in this field way too long. And that's not to say that I was expecting a bad outcome, but it was hard to be reassured. Much, much harder to be reassured when you've seen, it's like looking at a diamond. You don't just see the front facet. I've seen the side, the back, the angles, the upsides, the downsides. I've seen it all. So it was very hard to reassure me, and that made it impossible for me, that I could find no space where I could feel calm at the beginning. I was like anyone else. Whether I was a patient or a doctor, fear was the predominant emotion. In the world of cancer, there often is no certainty. There isn't even any certainty sometimes about which treatment protocol you should take. You can be offered this or you can be offered that because the physician feels that both of those treatment arms will give the same results. The uncertainty of making a decision, even though I live in a world of uncertainty as a physician, the timeline of having to make a decision relatively quickly and recognizing that once the information is presented, all you can do is then reach inside and let part of the emotion of who you are help guide you. And that, for me, was difficult to do because I am very much an evidence-based physician. And when there was no evidence to clearly say, do this or do that, I recognized that I then had to figure out what felt right for me. The decision to have a bilateral mastectomy was not easy. There was a lot of evidence that pointed in terms of this being the right decision for me and my situation. Emotionally I talked to my husband, and his attitude was, you're going to do whatever it takes to keep you alive. You're going to do what's best for you. He came with me to all the appointments. He's not a physician. It was difficult for him to listen to sort of what sounded like mutilating surgery, and it is mutilating surgery. My options afterwards in terms of reconstruction, which I chose, and the type of reconstruction that you can have. Decisions, 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 and more decisions. It's so damn overwhelming. I never was someone who defined myself by my breast. I'm way more emotionally attached to my brain and my ability to do the things that I love to do. But even having said that, it's not easy to make the decision to take both your breasts off. And I spent a lot of time talking to women who had bilateral mastectomies, which I think is a really good thing to do. Women showed me what they looked like without implants. Women showed me what they looked like with implants, different types of implants. And that was helpful. But no matter how helpful it is, it's not easy. Don't expect it to be easy. I don't think it's supposed to be easy. I remember one day where I was particularly, all those bad things that I was, and just impossible to live with, and very self-pitying, because this was happening to me. Where, my husband looked at me and he said, you have cancer, but you don't have to be such a witch, So, and it was like a good thing for him to sort of, be able to say to me, we're living with this too. So, if the more that you withdraw and the more that you push us away, the more impossible it is for you, and certainly the more impossible it is for all of us. That, those types of moments where I began to realize that I was being incredibly self-centered and selfish You know, I felt I was rightfully selfish. This was my disease, and I was the one having the biopsies and the surgeries, and I was the one with the chemotherapy, and I was the one with all the side effects, and I was the one with the joint pain, and I was the one going bald and lost my eyelashes and all the other horrible things that happened to you. But it was happening to them too. They were these passive bystanders who couldn't fix it for me and wanted to fix it for me. Do not think of yourself as a survivor. Think of yourself as a thriver. You know, you've been given this experience, one that you wouldn't ask for, but you know, you're through the technical aspects of it, and you're never really through it because you always have your checkups and you have the fear of recurrence and all the other things that come with the uncertainty of uncertainty. You know, the only thing that's certain about cancer is that you're uncertain about what's going to ultimately happen. But I didn't want to live there. I didn't want to live that way. You can choose to make that the focus of your life, or you can choose not to make it the focus. And I think it's like anything else. When you first are diagnosed, you can't get out of bed in the morning without the diagnosis physically smacking you in the face. And eventually, as time goes on, it's not so much in your face, but it's sort of beside you. Then it sort of gets to be a little bit behind you. And then eventually, as time goes on, you find yourself getting up not thinking about cancer at all. Maybe days or weeks or even months that you think about cancer until somebody mentions it, or you have an appointment, or someone else's experience makes you think about it. But that's what happens. You know, time sort of pulls it from here back there, which is where it should be, and allows you to not see it every living, waking, breathing moment like you do at the beginning. Because at the beginning, it's all there is. I think the best advice that I can give people is to feel your fear, meet your fear, and try and leave the fear a little bit to the side. Don't let it define every single waking moment. Recognize that you've got a team that's there to help you with treatment, and that you're on your journey of treatment, which is really important. You know, you've gotten the diagnosis. Okay, you got the diagnosis. Now you're going to move forward, and you're going to move forward with the treatment. And you're going to keep the lines of communication as open as you can with the people who treat you. Don't be afraid to ask any question. There's no question that's dumb. There's no question that you shouldn't ask. And there's no thought that you shouldn't speak out loud. It's the thoughts that you don't speak out loud, that you keep buried inside, are the ones that are going to eat you alive. And I would tell you that you have to recognize, although it took me a long time, that this is not a journey that you take alone. Let the world in. Don't shut the world out waiting for this to be over and for life to be normal. Accept that this is where you are right now, and accept all the support that you possibly can. And don't just focus on the physical things that are happening to you. You need to talk about the emotional things that are happening to you. And you need to recognize that this isn't only happening to you. It's happening to everybody else who loves you around you. So feel your fear, but give yourself permission at times to put it aside, because there is a lot more ahead of you. And you need to be present. I said at the very beginning that I didn't want breast cancer to define me, and I don't think it has defined me, but it certainly has refined me in some ways and changed me in terms of who I am. How can you not have any life experience not impact on how you change, albeit a breast cancer experience or a cancer experience or any time where you feel like your life is being threatened? With time, I began to recognize that this was one more life experience, and that it was going to definitely change the way I looked at the world, you know, make a difference in terms of who I was. And I had to accept it. I had to go with it. I had to stop being angry at it. I had to move forward.